Everyone. So Melissa, I think we can go ahead and stop the screen share. Thank you for that. It looks like we're going to have a very intimate crowd for this conversation. There were quite a few more people registered, so they might just join us as we get started. But great to see you all. So we are joined today by Brian and Coco from the Hope and Heal Fund to talk a little bit more about how we can combat gun violence in the communities in which we both work and live. So if you have any questions throughout the conversation, you can feel free to pop them in the chat, but we are going to save all conversations for the end, and we'll have about 15 to 20 minutes set aside. So with that, I'll pass it to you, Brian.
Great. Thank you, Zoe. Nice to see you, Carlos. And I know for the people in the recording, will be hopefully very beneficial to you all as well. Um, really wanted to kind of start out by talking a little bit about the Hope and Heal Fund, just by way of introduction for me. Again, I'm Brian Malty, Executive Director of the Hope and Heal Fund. I've been in the gun violence prevention movement for 30 years, most of it with the Brady organization, working here in California on gun laws and certainly nationally on gun laws, and came to Hope and Heal as the first executive director 7 years ago. And just a little bit about Hope and Heal Fund. We are a donor collaborative. And so what that means is foundations and others help to start Hope and Heal and contribute to Hope and Heal. We work alongside a lot of our partners. Some of our founding partners are the California Wellness Foundation, California Endowment, Blue Shield. So we've got a really great group of people. But we were formed, and I was still working back in DC when Hope and Heal was formed, and I knew something was kind of happening out here. But the way I understand that folks and foundations and others started the Hope and Heal Fund was certainly the recognition that more had to be done than just gun laws, right? We know California has the strongest gun laws in the country, and a lower gun death rate than other states. But as I always say to folks, there's 20 tools in the tool belt, and we've been utilizing like one for the last 30 years. So it's time we expand the tools in the tool belt. The other thing I'd like to point out is that gun laws will not get you all the way where you want to go. If you just look at the pandemic of the last year before the pandemic and social unrest, almost 3,000 people were killed in California by gunfire. After the pandemic, or the last year of the pandemic, 2021, gun deaths increased 20%. So we know something more has to be done. A lot more has to be done. Gun violence is a very complex problem, and it needs complex solutions. And I think that's why, from my vantage point, Hope and Heal was started. We don't work on legislation. We don't advocate. We work on all the other, I would just say, out of the 20 tools in the toolbox, we work on the other 19, right? We look at gun violence intersectionally, suicide, domestic violence, community violence, mass shootings, unintentional shootings. We look at it all. And if you can pick out most or a lot of firearm deaths, you'll find that one or two or three of those things are actually involved. You look at a mass shooting, suicidality is involved, domestic violence is often involved. So we cannot silo forms of gun violence. We must look at it holistically. So what we do is we approach the issue as a public health issue, right? And as a chronic issue. This is not episodic. I think the other piece of my frustration sometimes over the last 30 years being in this movement is it's about episodic. Oh, a mass shooting happened. Let's rally and let's figure out what we can do there. But every single day, Californians, Americans are dying, and a lot of impacted communities are overly affected and overly impacted. So therefore, one of the things that really makes Hope and Heal tick, and what we are at the forefront of all of this, in addition to public health kind of way of looking at gun violence, is a race equity fund. We know that communities of color have not had the input to legislative solutions and a lot of input in general. So what we do at Hope and Heal is we put community first, right? We want to ensure that those working on this issue, wherever they are in California, that their voices are heard and they have a stake in this, and they have input to what decisions their community is going to do. Hope and Heal, we don't prescribe what communities should be doing. Our job is to get community folks together to make sure that we provide them with some of the best practices and effective strategies where they can ask questions. But ultimately, it's up to the community to decide what they would like to do. And the solutions that, I should say, our framework that we look at is one of prevention, intervention, trauma healing and aftercare, cutting off easy gun access, and the cost of gun violence. This is our framework. And so one of the things that I think that is really important about that is that we're not only, well, I should say, we're not only looking at putting community first, but we're also looking at systems change, right? How can we adapt and change systems so they address gun violence in its totality? I think the last thing I'd like to say, and I'll turn it over to my colleague Kuko, is that I think it's really important to look at legislation in not just in like, hey, California has the strongest gun laws, but also looking at legislation. And like, I was a former policy director at Brady, so I was on the front lines of this, is that there's a lot of legislation that was passed in the past, federally or in California, that had, you could say, intended or unintended consequences for communities of color. Extra penalties, end user penalties, more incarceration, exemptions for law enforcement, right? So the way the movement has gone in the past is a over reliance on law enforcement and law enforcement's input into legislation. And you know how that's going to turn out. And that's exactly the way it turned out. If you look at the crime bill in 1994, which was the vehicle to get the federal assault weapons ban passed, the assault weapon ban actually sunsetted 10 years later, but the damage had been done to communities of color with end user penalties, massive incarceration, building more jails. So we really have to look, even if we are looking at legislation, we have to look at what are the consequences of that legislation, what deals have been made. But more to the point is we have to look at other solutions to gun violence. Again, this is a complex problem, and we need a complex solution and a multifaceted solution. But with that, I am going to turn it over to Kuko, and he can take it from there.
Thank you, Brian. Welcome, everybody. Pleasure to be here. I think I'll kind of continue on with where Brian left off. I think that as an equity fund for us and a philanthropic partner, I think it's important to state that part of our job is clearly looking forward in terms of the work that we're doing and integrating equity. But it also requires us to also look back, and also, again, not for the purposes of blaming, but it's important to look back at these things and to share with our partners that these are not things that we should be replicating. And certainly, a big part of our work is really spent on that, unfortunately, is having to remind organizations that there's a reason, that we're raising these issues and that they're of concern, because they have led to some horrible consequences in communities of color. And I think that, no organization that does this work really sets out to cause harm. But I think that we feel that part of our job, and unfortunately that's our role, is to point out that harm has been caused to our communities, in the name of good intentions, or whatever it is that you want to call it. And certainly in the gun violence world, especially when we talk about legislative approaches to addressing this issue, they have led to some pretty horrible consequences in our communities. And the 94 crime bill is one of those examples. Certainly the assault weapons ban is a good thing, and we want to support that. But in order for that to get accomplished, it really required these other legislative issues that got added in there that really had a substantial, a really negative impact on communities of color, particularly around incarceration, prosecution of young people as adults, those types of things that we're still trying to kind of address the impact of. And so I say that because I think that a big part of our job is also to point out to folks that we need to be very cautious, and more importantly, that I think it's important for us to point out that where we are at today in terms of our level of at least having a conversation and understanding about equity, issues of disparities, is a very different place than we were maybe 3 or 4 years ago. And as a consequence, that should be enough reason for us to kind of pause for a little bit and rethink the way that we're approaching things. And if we're continuing to operate in the same way as we were 4 years ago, but the difference is that we've articulated our commitment to equity, then not much has changed. And so it's important for us to really question some of that. So I think I want to mention that because I think that's I wish that wasn't part of our work, that people would just get it and then move on with different practices that are incorporating values of equity and principles and practices of equity. But unfortunately, we're spending a considerable amount of time in pointing that out to some of our partners because it's important. We don't want to cause any further harm to communities. And gun violence is one of those issues that really has a significant impact on our communities, not only in terms of the availability and what we see in terms of the impact of gun violence, but also on the prosecution side, in terms of possession and so forth. But I'll get into a little bit of that as well. But I wanted to point that out because I think as an equity fund, that's a big part of our work. We really, as an organization, look at the intersection of 3 areas. We look at, of course, reducing gun violence. And we look at that comprehensively. It's not just one particular area. It isn't just homicides. It's homicides and suicides. It's also addressing the issue of mass shootings to the extent that we can, because that's still something that that's evolving in terms of our understanding. And then also the issue of officer-involved shootings, which a lot of organizations don't address, but that is gun violence, and that has a significant impact on communities, particularly of color, who are affected by that. So that's also an area that we look at as well. We also look at the issue of course, of equity, race equity specifically, and how that intersects with gun violence reduction. And then the third area of focus for us is how systems change, systems analysis, systems mapping, or institutional kind of approaches and looking at systems, where those 3 things kind of intersect is really where we try to center our work. And I say that because what we don't do is legislation. We do everything else but, and I think as Brian points out, there's 20 different tools that we can utilize to address the issue of gun violence. And 90% of the folks that are doing this work are using one tool, which is legislative approaches. And again, I'm not saying that doesn't work, but because of the issues that I pointed out to folks around kind of some of the pitfalls and some of the issues of inequity that get created by legislation, I personally am a bit hesitant to support legislative solutions to this issue until somebody can tell me clearly what their race equity analysis or lens was to get to kind of the conclusions that this is something that we should support. So our work is really everything else outside that, and our work is really around systems. It's a big area, and again, the way that kind of plays out in terms of some practical examples. Some of it is large systems work in terms of looking at institutional structures and how we can map systems and identify critical control points that we can begin to make adjustments on that we feel lead to significant reductions in gun violence. So one example of that, I'll give you the final analysis that we did, is really looking at systems that engage or have contact with what we would call vulnerable populations, in this case, in terms of gun violence. And one of those systems is mental health, the public mental health system. Again, clearly they have a lot of contact with populations that are vulnerable in terms of the issue of suicide, harm to self, maybe not harm to others. And so we've developed some analysis and been working with mental health systems. And what we identified as a systems change lever that we've identified as a critical control point is that it's the issue of access. When you look at some of the other things that we know about gun violence, in homicides and suicides, it's really about access during critical times. So, for example, in mental health, what you're looking at is an underlying mental health condition or untreated mental health issue or trauma. You add to that alcohol use or drug use. And then the third item would be a crisis or situation that occurs in your life. Those three things already create kind of some issues for an individual. If you have all of those three things, you add to that access to a firearm, and now the probability of lethality has increased considerably. So knowing that, what we began to look at is mental health clearly is one of those areas where you have a high proportion of vulnerable folks in terms of suicide. And so we begin to narrow our focus around access. And what we identified is that there is no mental health county in the state of California, but probably across the country right now, where we're assessing for risk in terms of gun ownership. So despite the intrusive nature of mental health in what they call kind of a risk assessment. So, I go in to see a mental health practitioner. They will assess me. I will do a couple of screenings. I may score positive, what they say will score positive on the screening for, let's say, suicidality, PTSD, certain things. The ideal situation for us and what we're recommending for mental health to do, and we've been working on in terms of some strategies, is to begin to question, well, if we're assessing for risk, we're assessing for drug use, we're assessing, it's quite intrusive if you've never seen an assessment. They ask you about sexual history, they ask you about drug use. It's a lot of really intrusive questions. But what we don't ask in that system is, do you own a gun? Or does somebody in your household own a gun? Especially if you had tested positive for suicidality or other mental health conditions that lead to where that might be an aspect of it. So we feel really strongly, and I think we've identified a really critical point, control point that doesn't cost a lot of money, that we feel can significantly reduce the incidence of suicides within that population if we were able to identify. So if I'm a therapist and I'm working with two clients, they both have, let's say, struggle with issues of suicidality. One doesn't have a weapon, the other one owns 3 or 4 guns. My hope would be that the crisis plan, a lot of the treatment planning would look a little bit different, especially in terms of when somebody is beginning to kind of manifest some aspects of suicidality, especially if I'm aware that they own 3 or 4 weapons. Because again, the unfortunate, what we do know about the rates is that only something like 10% people survive suicide with a firearm, an attempted suicide, where in other types of suicide attempts for folks, survival rate is 90%. So this really becomes, again, we feel like we've done the analysis and have really began to focus really well on a critical control point. We are working with certain mental health systems here in California, the public mental health system, in terms of integrating some protocols around the identification, but also in the terms of the development of treatment planning and the implications of having that information now. Our hope is that in a couple of years, we can see a significant reduction in terms of suicide rates within that population, within that particular system. Another example of kind of this type of kind of approach in terms of systems, where systems intersect equity, but also reducing gun violence, is that on a smaller level, we are also working with communities, developing some strategies where, I worked in mental health for a long time, so I kind of based it a little bit on that, which is some of the logic. I've worked in philanthropy for some time as well. And while I appreciate the notion of engaging communities in solutions, I also felt that it's a bit disingenuous sometimes because we don't do it on community terms. We do it on our terms. And oftentimes, I think that we bring in community to address very complex issues that we have not afforded them. And again, not that they can't comprehend the complexity, but we've never primed them or afforded them the opportunity to understand the complexity of things so that they can be well informed about their decision making. And so the example that I give, so we developed something called a community hub that we've implemented in a couple of different places, just to really, again, increase the capacities under the community and other stakeholders' understanding of their capacity of the issue of gun violence. And the reason I'm saying that is because, again, I feel as a community person, as an activist, but also now in philanthropy, trying to see how we can really create equity in terms of the processes that we engage in. Because, like I said, I feel like I've been involved with organizations or partnered with organizations that set out to involve the community, and it becomes a checkoff because in reality, the community couldn't really participate as actively as we thought because it was a little bit of an unfair process for them for a couple of reasons, and I'll explain that. For me, I always appreciated in mental health, but also in public health, the idea of informed consent, which is you come in, the doctor tells you you have a particular diagnosis. And what the doctor does not do is the doctor doesn't say, well, Kuko, you have cancer. How would you like me to address that? Well, I have no idea. I have no information. The appropriate way that this works in terms of informed consent so that I can be active in my treatment is to say, here's the diagnosis. Here's what you should expect. This is what's going on. Here's the symptomology. They give you all of that. And then after, they say, here are the modes of treatment. You can do A, B, C, D, or E, or F. Now, when I have a conversation with you and saying, how would you like to treat it? Now you have some information. And in a certain way, that's kind of the way we are approaching this hub around gun violence, is that we don't want to start with, hey, tell us how to fix this. We want to start with, look, here's what's going on in the community. Here's what the data is telling us. Here are some of the interventions that people have utilized across the country. Here's some frameworks that identify how gun violence works, what are the critical control points, what contributes to gun violence, what are some of the resources. Once we walk the community through that, then now we have a conversation about what are the solutions. And we feel that that's a much better place where we increase the capacity of stakeholders, but we also empower the community to have some clear say in what they want as solutions for the community. Otherwise, what I think we get is a lot of the community weighing in on their pain, which again is important to create those spaces, but that's not the best way to create solutions. And more importantly, what we often have seen when it doesn't go right is that community members end up deferring to either nonprofit agencies or law enforcement or other folks because they feel ill-equipped to make some of these decisions. So we've developed this strategy more or less to kind of support, again, the voice of community, but also to increase capacity. And as Brian said, our job is not to make decisions for the community, but our job is to provide a lot of the information so that then the community can decide how they want to address this particular issue versus, I think, communities that might stay silent if they don't have information. So one of the last things I will share with you in terms of kind of some of the work that we conduct and how we're trying to address and contribute kind of to the field of this work is that the other area that we're very engaged in is in technology. And again, looking at the intersection of these three things: gun violence reduction, systems, and equity. One of the areas that we've been really, really focused on, and we will send you a copy of or a link to the report and the map. We've been really engaged in what we call our GIS mapping, and that's been very, very important because it also feeds into a lot of the narrative change work that we've been doing, which is really shifting narratives about communities, especially when it comes to gun violence, and especially narratives about communities of color. For a long time, I think in this field, and I'm sure many of you might actually, because this is a very common a talking point that folks make. Oh, thank you, Zoe. Zoe just added that to the link. It was this idea that in California, as well as in other states, that the majority of homicides in the state were really driven by homicides in large urban centers. So San Diego, Los Angeles, Sacramento, San Francisco, these areas are really what make up the vast majority of homicides. And when we started looking anecdotally at the numbers, that just wasn't adding up. The math was not adding up. When you looked at the rates at some of these largest urban areas, most populated cities. And so we set out to map, and what we did is what you see there is a map, the last 9 years basically of homicides across the state of California, mapped right down to the street level. And you can query it by year, you can look at it for 9 years, but you can zoom in pretty deeply and you can see kind of the street level. And we did that on purpose because I think that we really want people to see that every one of those dots is actually a life that was lost in this state in the last 9 years. But we also did that to also have people really understand visually that when you look at those rates, the vast majority of those rates are not in urban areas. They're in a lot of these smaller communities where gun violence now is really an issue that has affected the whole state. And the majority of these homicides, unfortunately, have been in non-urban settings, suburbs, rural communities. I'm in Chicago today, but I live in near Santa Barbara County. There's a couple of communities that are not very large near where I live, 40,000 people, 45,000 people, that unfortunately the rates are probably some of the highest in the state. But, they're not, they don't exceed, let's say, 10 or 15. And so people think that's a low rate, but in reality, per capita, that's super high for the proportion of the population. Small communities like Delano, Lompoc, these smaller areas, Patterson is actually where I'm from, some of these smaller areas that might have 3 or 4 or 5, but when you start adding up these small communities, those are really the communities that are driving some of this. And again, that's an example of some of the work that we're doing, and it's important work primarily because it helps us really begin to understand the impact of gun violence in communities. San Diego, of course, is impacted in some very specific areas. The geography is very concentrated in San Diego, and then you also have on the outskirts of a lot of the San Diego. And so while part of the other reason we did this is because from a systems change standpoint, while San Diego is one of the safest counties in the country, it is due primarily because of your large population size. But if you live in Barrio Logan or Southeast San Diego, and if you look at the concentration of where those homicides occur, that's probably one of the unsafest areas to live in the country. However, when you get that data and you drop it into the total county population, then all of a sudden San Diego becomes one of the safest counties in the state or in the nation. But in reality, if you live in those communities, we should be very concerned because it's highly concentrated. And again, if you're living in those communities, it probably doesn't feel like the third safest counties in the state. So I think some of that data is very important. The last part I'll say about this particular initiative is that we also are working with nonprofit agencies. And again, I'll pitch this to San Diego because we are looking for funding to replicate this in Northern California as well. This particular training was funded through Kaiser to do, Northern California. We're looking at Southern California and San Diego. And we've trained 30 nonprofit agencies that do gun violence work or are doing community work, grassroots organizations. We do like a 10-week training, kind of virtual and a little bit hybrid in person. We meet twice in person and then we do it virtually for the actual training on how to utilize GIS, how to learn to map your own data. So we've trained 30 nonprofit agencies on how to map their own data. They've created some great maps and have contributed considerably to kind of some of the work that we're doing. And again, we're trying to house a lot of their maps in our hub We're trying to create a lot of that, but certainly we would love to do that in Southern California to train nonprofit agencies to learn how to map their own information. And again, even though the focus is gun violence, we make it very clear to everybody that you can map almost anything once you learn how to do this. So it's very helpful because you can overlay map on map to begin to identify key areas of concentration, or what they call heat maps and heat areas where you can focus and target resources. This mapping project for us is very important because not only does it identify homicides, but now we're looking at an additional map that's looking at the number of suicides and firearms, as well as disaggregating the data in terms of homicides to see how many of those are actually intimate partner homicides. Because again, from a funding standpoint, that's a very important thing to understand, because if you're funding homicides in general, it's one thing, or gun violence. But if you want to address the issue of intimate partner violence, then not only does it give you geography potentially, but it also begins to give you the areas that are impacted the most and how you should be resourcing that so that you can resource it appropriately and equitably to address community violence and then intimate partner violence. And more importantly, those two things require two very uniquely different interventions. So I'll stop there to see if anybody has any more questions. I have additional data or information to provide, but I want to leave it open to see if anybody has any questions so I'll just stop.
Thank you so much for that, Kuko. I know we have a small crowd here, but also for anyone watching the recording, Brian and Kuko are both available to reach out to and connect one-on-one for any questions. So yeah, I'll leave it back to y'all.